How often do wound dressings need to be changed? Is there a formula that you use?
Different setting requires different frequency. So, for example, to accommodate visiting nurse, we think of the dressing that can last between nursing visits. So, if an average wound care visiting nurse comes every 2 or 3 days, so we need to pick the dressing that will last between the visits. Uh, for example, hospital-based setting versus nursing home setting, we more likely to utilize very qualified nursing staff because they are available 24/7. So we may see daily dressing changes ordered. So yes, it's really depends on how much drainage the wound has, what are the other characteristics of the wound, and what type of dressing we use.
Speaking of the type of dressings, what is the difference between a wet dressing and a dry dressing, and when are they used?
The basic principle of choosing the wound dressing is if the wound dry, wet it, and if the wound wet, dry it. So so-called wet dressings could be an ointment. So in wound care world, we call everything a dressing. So even if something is poured from the tube, a gel or an ointment, that would be considered a wet dressing. Versus something very, very absorbent and dry, that would be dry dressing and absorbent dressing that's being used in wet wounds, in wounds with a high drainage.